Members, good morning. Thank you for attending this meeting of the Bills Committee on Tobacco Control Legislation Amendment Bill 2025. Agenda Item 1, Meeting with the Administration. Let me first invite government representatives to enter the meeting room. Attending this meeting, we have Dr. Libby Lee, Undersecretary for Health, and her team. I'm not going to read out their names one by one. Please refer to the agenda for their names. I'll first like to discuss with members about this. I suggest that we invite public views. That is written views from the public. If members agree, we will invite written views from the public and we will pass them on to the government so that the administration can give us a reply. Now I will invite Dr. Libby Lee, Undersecretary for Health, to walk us through the paper, and Mr. Eddie Lee afterwards will give us a PowerPoint presentation. Undersecretary, please. Good morning, Chairman and members. I thank members for attending this first meeting of the Bills Committee, as mentioned by the Secretary in the second reading. Tobacco control is like a boat sailing against current. The smoking prevalence dropped from 95% in 2021 to 9.1% in 2023, but 580,000 people are still daily smokers. What is more worrying is that there are smokers of alternative smoking products, ASPs. Many primary and secondary students, they consume ASPs. That shows that ASPs are popular among young people. So one of our tobacco control strategies is to reduce the appeal of ASPs so that the new generation will not become addicted to ASPs. Cigarettes, they pose healthcare risks on our society. According to a study carried out by the Hong Kong University, every year an economic loss of $8.5 billion are brought by tobacco-induced diseases. With aging population, as well as tobacco-induced diseases, they will strain our healthcare system. So there is a pressing need to control the consumption of tobacco to protect public health. Last June, the Health Bureau announced a series of measures that include short-term, medium-term, and long-term measures to control the use of tobacco. We're working towards 4 directions, that is, reducing the supply and demand for cigarettes, and secondly, reducing their appeal, and thirdly, protecting the public from the harm of cigarettes, and fourthly, providing smoking cessation services. We have 10 strategies in place. And this bill seeks to amend CAP 371, Smoking Public Health Ordinance, as well as CAP 109, Dutiable Commodities Ordinance. This bill provides legal basis for 8 of these strategies. And also, we seek to review the adjustment of tobacco duty and the provision of smoking cessation services, but they are not included in this bill. The Deputy Secretary will then walk us through the major strategies that we propose. Enhancing tobacco control is the global trend. The WHO has called on countries to impose more stringent measures. In the 2023 public consultation, 90% of the respondents support strengthened tobacco control. There should be forward-looking strategies. Otherwise, public health would be compromised. I'd like to take this opportunity to stress that economic development and tobacco control are not mutually exclusive. After the introduction of the bill in the end of April, I see that most members of the public support the tobacco control measures proposed. We also want to display our determination to protect our young people from tobacco products. It is only that young people thrive that the city will prosper. We will promote more smoking cessation or activities to promote quitting smoking at schools. We want to contribute more to the well-being of the public. I hope members will support our bill. I'll now invite the Deputy Secretary to walk you through the tobacco control strategies. Afterwards, we will address members' questions. Deputy Secretary, please. Good morning, members. I will quickly go through the content of this bill. This is a background for members. The 10 tobacco control strategies are the short-term measures listed out in this table. Last June, we announced 10 measures. More than 10 measures. Some of them are short-term measures, some of them are medium-term measures. This bill mostly focuses on the short-term measures. The so-called 10 measures are in green here. For number 9 and number 10, the items here that are to review the adjustment of tobacco duty and to step up smoking cessation services as well as publicity and education, they are not included in the bill. So we are mostly focusing on the first 8 items in the green table. I'm not going to go through the background here. It was touched upon by the Undersecretary just now in her opening remarks. I'll now go directly to the 10 measures. First, to improve the duty stamp system. We want to combat illicit cigarettes. That's why we're introducing this duty stamp systems. Importers and manufacturers of tobacco products in the future, they'll have to make sure that in the packaging of cigarettes, there should be a duty stamp affixed to show that the cigarettes are duty paid. We will apply anti-forgery features as well as related digital technologies for the duty stamp. This will only apply to conventional cigarettes but not other tobacco products, because we see that the problem mostly lie on conventional products, and those who break the law will be liable to a $1 million fine and 2-year imprisonment, or on summary conviction to a $2 million fine and a 7-year imprisonment. The Customs and Excise Department will launch a pilot scheme in Q3 this year to show to importers and manufacturers the process, that is how they should affix the duty stamp and how we will make use of our computing system to check the duty stamp. In Q4 next year, we will launch the first phase of the measure. That means by then, all duty-paid cigarettes should have a duty stamp affixed on the package. We will still allow for some of the cigarettes that are not sold and without the duty stamp to be sold in the market. And by 2027, we will launch the second phase. That means by then, all cigarettes sold in the market, they will have to be duty paid, and there will have to be a duty stamp affixed on the package. Many cheap whites in the market, they are sold at a lower price than the duty imposed. We will amend Cap 109, the Dutiable Commodities Ordinance, to require that tobacco traders will have to prove that cigarettes sold at a lower price are duty paid, and this will take immediate effect upon Gazetted of the amended ordinance. Now, on imposing tougher penalties for non-duty paid cigarettes. Currently, the penalty is $1 million and 2-year imprisonment. And we will increase the penalty to $2 million fine and 7 years of imprisonment. We will list this offense into the organized serious crimes ordinance to freeze the proceeds. Currently, if you bring over 19 sticks of cigarettes or cigarettes that exceed the duty-free limit, the Customs Excise Department, they impose a compound. If the duty-free limit is exceeded, currently the fine is $2,000 fines, and the fine will in the future be increased to $5,000. Again, this will take immediate effect upon gazettal of the amended ordinance. Measure 3, prohibiting the possession of ASPs. In year 2022, on the 30th of April, the import, manufacturing, sale of ASPs was banned. And this ban has taken effect for over 3 years now. Currently, there should be no legal means for people to purchase ASPs. And the ASPs manufactured or imported, they should have been mostly consumed by now. In response to public aspirations, well, the ban has been imposed for some 3 years now. We should take the next step, that is, to prohibit the possession of ASPs. For the first phase, we will ban the possession of ASPs in public places. We will also ban the possession of ASP substances, that is, e-liquid capsules, heated sticks, and herbal cigarettes. To facilitate law enforcement, well, for those who are consuming or carrying ASPs, according to our bill, under such circumstances, we will regard it as possessing ASP substances. Under the proposed regime, we will introduce a fine of $3,000 for those who possess not more than 5 millimeters of e-liquid and 100 sticks of heated cigarettes for non-commercial purposes. In terms of the date for implementing the ban, it is the 30th of April 2026. We are imposing this measure 4 years after the implementation of the ban of sale and manufacturing of ASPs. Depending on the effectiveness, we will review whether there is a need to extend this ban to all kinds of premises apart from public places. We'll also see whether there is a need to ban the possession of vaping devices. We're not fixing a date for imposing this at this stage. Fourth measure, implementing plain packaging requirement. We currently require all cigarettes sold in Hong Kong to bear health warnings on the packet which cover at least 85% of the display area. In the future, cigarette packaging will have to adopt a standardized color, font, and logos, and so on, to dampen the promotional efforts of cigarette traders through packaging. This is not set out in the bill because we're just imposing this requirement under the bill, as we will have a subsidiary legislation setting out all the clear requirements in the future. So this has to do with the design of the packaging and the duty stamp to be imposed. we need time to come up with all these requirements, so we will have to wait until the implementation of the duty stamp regime, that is Q2 2027, to implement this new requirement.
The fifth measure is to prohibit smoking while queuing. We will prohibit anyone to do a smoking act while queuing to board in a line with more than 2 persons. Under CAF 371 Smoking Public Health Ordinance, we have set out the definition of public transport that include buses, minibuses, and so on. People are also prohibited to smoke while staying in the delineated area for a designated boarding location, irrespective of whether the person is waiting to board a public transport carrier or whether they are just loitering around there. Say this is a bus stop with covers and delineation. No one can smoke here. Again, if it's an outdoor area with a line, you also cannot smoke. Even if you are alone, you should not smoke if you're within the delineated area of a public transport carrier. When people are queuing to enter specified places, they also should not smoke. We choose places with queues, such as theme parks and hospitals. Anyone who contravenes the regulations will be subject to a fine. On the 1st of January 2026, the ban will take effect. After the passage of the bill, we will step up publicity and promotion. This also shows some example. If you're queuing to enter a clinic, you should not smoke. The sixth proposal is to extend statutory NSAs and increase fixed penalty for smoking-related offenses. In order to protect people from the harmful effects of secondhand smoke, in designated areas including child care centers, schools, residential care homes, hospitals, designated clinics, or health centers, areas that are within 3 meters of the outer edge of doorways or gateways from these places are designated as NSAs. We do have a defense. If someone does not know that there is a doorway or gateway to the specified premises, then they can raise a defense. We empower the Secretary for Health to designate no smoking areas and to include exempted areas. The government and the Secretary is empowered to designate large areas as NSAs, including escalators, cinemas, and so on. We are going to introduce a new provision to empower the Secretary also to designate a large area as NSA, including designating exempted areas. Currently, the fixed penalty for smoking at public transport carriers is $1,500. It has not increased since 2009. We propose to increase it to $3,000. It will take effect from the 1st of January 2026. As you can see, there is a school here. Within the 3 meters from the outer edge of the doorways or gateways of the school, no one can smoke. The seventh proposal is to prohibit the provision of smoking products to persons aged below 18. Current legislation stipulates that no person may sell any conventional smoking products to any person under the age of 18. However, in order to protect our next generation, we propose to prohibit the provision of smoking products to any persons aged below 18, including conventional smoking products and ASP. If small quantities of ASPs are included, we propose to handle it by way of fixed penalty. For ASPs, we are going to prohibit the provision of such products to any persons aged below 18. Any offenders are liable to a fine at level 5 and up to 6 months of imprisonment. The last proposal, we are going to ban flavored conventional smoking products. For persons aged between 18 and 29, over 70% of them currently smoked flavored cigarettes. And about 70% of young smokers smoked flavored cigarettes when they first smoked. So this shows that tobacco products with flavorings will lower people's awareness of the harmful effects of these products. They may think that these products are less harmful, and that actually increased the appeal of these products to young people. We will prohibit the sale of flavored cigarettes. By flavorings, we mean traditional additives that are added to conventional smoking products. On the sale of flavored cigarettes, we will introduce a certificate of compliance system. Any supplier of conventional smoking products may only distribute products unless they have a certificate of compliance issued by the Director of Health, and they have to certify that the products they sell do not contain any specified additives. Any offenders will be liable to a fine at level 5 and imprisonment of 6 months. We are not proposing to ban smoking of flavored conventional smoking products or ban inbound passengers from carrying a small quantity of such products for personal use to Hong Kong. So they can bring no more than 19 of such flavored conventional smoking products. If they bring in more than that, they have to pay duty. As we want to first implement the duty step system before we ban the conventional flavored smoking products, that's why we have not set a date when this ban will take into effect. We are going to ban the provision of flavored smoking products in phases. At the first stage, we will ban smoking products with menthol, and at a later stage, we will extend it to cigarettes with other flavors. That's our overall plan, including our measures, the maximum penalty, and the effective dates of these measures. Thank you. Thank you, Deputy Secretary. We will first discuss the policy matters of this bill. If you would like to put questions, please press the button. There are already 11 members who have pressed the button. I'll read out their names. First, Ms. Lam So Wai, Dr. David Lam, Mr. Stephen Ho, Mr. Xiu Ka-fai, Mr. Dennis Leung, Ms. Doreen Kong, Mr. Chan Pui Leung, Ms. Chan Hua-yan, Mr. Tan Fei, Ms. Carmen Khan, and Ms. Lillian Kwok. Each member will have 4 minutes, including question and answers. Other members may still continue to press the button. First, Ms. Lam So Wai. The speaker is off mic. Ms. Lam So Wai. Thank you, Chairman. All countries in the world is trying to lower the smoking prevalence and control tobacco. I do agree that the government must work on it. But how do we make sure that our measures are accepted by everyone in society? The strength of the measures is substantial. We see the government's determination, but some stakeholders are aggrieved by these measures. I'd like to talk about flavored conventional smoking products. We have rolled cigarettes and all sorts of smoking products. Most of them, 100% of them, are flavored smoking products with vanilla flavor or whiskey flavor. They are different from other types of flavored cigarettes that are trendy. Are we banning all sorts of flavored cigarettes? Such as tobacco pipes? Because the industry and the trade told me that they are worried of not being able to survive. What about shisha? Not that many people actually smoke it. Shisha is usually with fruit flavors. How do we make sure that the F&B industry and the catering industry will not be undermined because of the ban? I understand that we don't want young people to pick up smoking. Most of them, when they first smoke, actually try fruit-flavored cigarettes. Currently, anyone above the age of 18 can purchase cigarettes. Will we further raise the age threshold to, say, 21 years old? When retailers suspect that purchasers of cigarettes are aged below 21, they can check their identity cards. By this, young people will not pick up smoking. Thank you. There are a few questions. Undersecretary, thank you. What about cigars, tobacco, pipes, and cut tobacco? I will ask the Deputy Secretary to talk about that. I thank Ms. Lam for her support towards our tobacco control measures. We don't want young people to pick up smoking. Our measures are to prevent young people from becoming smokers. Shisha is a type of conventional smoking products, so no one should smoke it in indoor areas. For businesses, they can allow the customers to smoke it at outdoor areas, but for indoor areas, no one should smoke it because they are considered flavored conventional smoking products. Deputy Secretary, thank you. Regarding cut tobacco, Controller of Regulatory Affairs. Regarding cut tobacco, pipes, and cigars, WHO says that when we control tobaccos, we should cover all types of products. If our regulations are not comprehensive enough, then there will be replacement and merging. For rolled cigarettes, we're going to control it. If there is discrepancy in regulations over some types of products, then people may try to replace conventional smoking products by, say, hand-rolled cigarettes. In other countries, we see hand-rolled cigarettes being packaged as tobacco pipes to circumvent the law. In light of this situation, WHO strongly recommends that all smoking products should be considered or treated equally. We see unflavored hand-rolled cut tobacco products on the market. Of course, flavored one would be more popular, but we do have unflavored cut tobacco available on the market.
下一位係
Next, Dr. David Lam. Thank you, Chairman. I'm happy that the government is introducing the Tobacco Control Legislation Amendment Bill 2025. I have a couple of questions. The laws in Hong Kong are quite stringent, but law enforcement has all along been an issue. People smoke in the back staircase. This has been very common. How can the government enforce the law after implementing the bill? It's easy for you to enforce the law within the control boundary, but at the border control points, it's not easy to enforce the laws. Also, according to the bill, 3 meters within 3-meter area of the hospital and other designated premises will be designated as no smoking area, but near schools or clinics there are fences, and near the fences there are queues of students or patients. For areas that fall outside of the 3-meter distance, they can smoke there. Well, smokers in Hong Kong are quite good as long as they do not affect people in the queue. It's all right. So will you expand the 3-meter distance or 3-meter area? My third question is that by Q2 2027, you will ban the ASP substances or the flavored cigarettes, and for menthol cigarettes, you are not banning them. Statistics have shown that young people, especially women, they like menthol cigarettes. If you don't ban menthol cigarettes, it's going to be a loophole. Like the Undersecretary said, this might give people the impression that menthol cigarettes are less harmful, but this is not the truth. Lastly, we previously had a discussion about whether we will draw a line, that is, people born after a certain year, we will ban them from buying cigarette products. Undersecretary. The fourth question. We may consider drawing a line in the medium or long run. In the short run, we want to implement the 10 strategies as soon as possible. In terms of law enforcement, I will invite Mr. Rudy Hui, Deputy Commissioner. And for the other questions, I'll invite Dr. Feng Ying as well as Mr. Eddie Lee to reply. Deputy Secretary, on the point about fences, we've thought about this. There are many schools and hospitals in Hong Kong, so we thought about including the area around the fences. We've also thought about designating the surrounding area near schools as no smoking areas, but it's hard for us to decide what area should be covered. So our major principle is that the bill will have to be clearly comprehensible to the public and it's enforceable. So we focus on entrances and exits. There are multi-story buildings or industrial buildings, and we're not designating the entrance area of those buildings as no smoking area. If we set an area too wide, there might be potential issues. For some fences that are covered by vegetation or planters, people may not know that they are NSA, so we decide to set the no smoking area within the 3-meter area of certain premises so that smokers know that they shouldn't smoke within the 3-meter area. is Dr. Feng Ying to respond to the question about law enforcement. In some no-smoking areas, there are still smokers who smoke. We inspect black spots. We conduct patrols there. Over the past 2 years, we've adjusted our enforcement strategies. We mount plainclothes operations, and we've seen results. In year 2023 to 24, the fixed penalty tickets issued have increased. In year 2024 compared to 2022, the number of tickets we've issued doubled. So we've seen results in our enforcement work. Around the end of this year, we will roll out an electronic system to issue fixed penalty tickets. This will help simplify the procedures, and this will also help boost efficiency. We believe that the amendment bill will create a deterrence because of a higher fixed penalty. On enforcement at border control points, the Custom and Excise Department have been enforcing law at the border control points. To give you some statistics, in year 2024, we've seen more enforcement from 9,000 to 19,000 cases. After the opening of border control points or resumption of normal travel, we've seen more people or tourists not making proper declarations of their cigarettes. So we are imposing a higher penalty, that is a fine from $2,000 to $5,000 for such crimes. Mr. Chen Pui-Leung. Thank you. I, in general, support this bill. I support the incremental approach. A number of measures have been proposed by the government. I believe the government will face certain challenges in enforcing the laws. Take the duty stamp regime as an example. All cigarette packaging will have the duty stamp affixed. What about I get individual cigarette sticks instead of a whole cigarette pack? Because there won't be duty stamp on individual cigarettes. This system may be able to combat non-duty paid cigarettes, but I'm quite worried about illicit cigarettes still. From the statistics provided just now, cases involving illicit cigarettes have increased by 150%. Well, this is just the tip of the iceberg, I believe. Even with the measures to be implemented, I think the cases involving illicit cigarettes would still be very serious. How can we combat illicit cigarettes effectively? On no-smoking areas, I think this is quite controversial. The government is trying to ban smoking in different types of premises. The 3-meter area is proposed, but how can we tell that it is a 3-meter distance? How can you ensure that there will not be disputes between smokers and law enforcement officers? Lastly, on TACO, we don't have many officers working under TACO, the Tobacco and Alcohol Control Office. In the future, with all these tobacco control measures, will you consider increasing the number of law enforcement officers under TACO? 3 questions about illicit cigarettes, no smoking area, and tobacco. On the question about duty stem, I'll defer to Deputy Secretary, and the other questions I'll ask Mr. Feng Ying and the CNED to address the questions. Deputy Secretary, on individual cigarettes, some lawbreakers may want to circumvent the law by buying individual cigarettes. This is against the law. Under Cap 371, people cannot pack cigarettes. Less than 20 individual sticks of cigarettes. Mr. Feng Ying, each step made by an adult is about 0.6 to 0.7 meter. So a 3-meter distance is about 10 steps for an adult. Before we implement the bill, we will have a wide publicity campaign to remind managers of different premises to put up notices, to remind people to abide by the law. On manpower, based on the actual needs, we will apply for additional manpower in accordance with the established mechanism. CNED. The CNED has been adopting different strategies to enforce law through, for example, intelligence collection. We will also adopt the upstream, midstream, and downstream strategies. In the upstream, we'll combat cross-boundary illicit cigarettes. In the midstream, we'll combat storage. And downstream, we combat illicit cigarettes in the market. Also, we will step up collaboration with overseas law enforcement agencies and those with the mainland. More importantly, we have to educate the public. If you bring cigarettes that exceed the duty-free limit, please make proper declarations. Next, Mr. Peter Xu. Thank you, Chairman. Smoking is harmful to people's health, so we're all for the tobacco control strategies. So we don't have to discuss the harmful effect of smoking. We all know that. But there are controversies in the community. I agree to some of the tobacco control strategies. For example, smokers should not smoke when they're queuing in order to minimize the impact on others. Smoking is harmful to people's health, so why don't you ban smoking while walking? You're banning fruit-flavored cigarettes and you're banning menthol cigarettes at the next stage. If they're so harmful, how come you do not impose the ban all in one go? Like Dr. David Lam said, visitors may come to Hong Kong to smoke. If smoking is so harmful, why don't you ban tourists or visitors who come to Hong Kong from smoking? If you're not doing this, what are your considerations behind? Well, I'm not in support of all the tobacco control measures. I'm only supporting part of them. Yes, Undersecretary. There are about 580,000 smokers in Hong Kong. Most of them are males, and they're mostly in their 40s or 50s. That is between the age of 40 to 59. Under the primary healthcare scheme, we rolled out recently the co-care disease scheme, and we invite those aged about 45 to join the scheme. And those who join the scheme, they're mostly in their 60s, and a lot of them, they do not know that they have high blood pressure or high cholesterol. So male smokers between 40 to 59, they do not come for screening. Those who join the scheme, they're mostly female. So I'm worried that these people, they will only see the doctor when they get old. That would be too late. The purpose of our tobacco control strategies is that there might be more people with chronic illnesses in Hong Kong compared to other countries. On smoking while walking, well, one of the provisions in the bill is to empower the Secretary to extend the no smoking area. People will not be able to smoke in the no smoking areas, not to mention smoking while walking. We try to extend or expand the no smoking area to combat smoking while walking. As to why we're not banning all the flavored cigarettes, in the 2-year-long public consultation, we've heard people's views. They need time to adapt to the new laws. That's why we are taking an incremental approach to ban flavored cigarettes. Around the world, there is no one single country that bans visitors from smoking in their countries. That's why we are exercising lenience over tourists.
Mr. Xu, I already said that we are not here to discuss the hazards of smoking. The secretary spent so much time on explaining it in her response. My question is very simple. Why don't we ban people from smoking in Hong Kong altogether? For flavored cigarettes, menthol cigarettes, why don't we ban them altogether? Why don't we prohibit people from smoking while they walk? What were their considerations and reasons? Let me supplement. Because of the illicit cigarettes problem, we believe that if we don't ban the sale of illicit cigarettes before we ban the flavored cigarettes, we think that there will be a rise in the sale volume of illicit cigarettes. Smoking is harmful to people's health. The Health Bureau is now not trying to prohibit smoking altogether. They think that we have to allow smokers some time to adapt to the new measures. Many medias, members of the public, and LegCo members have questions regarding the 10 measures on the effect on the tourists and people. We have questions about the measures, not because we support tobacco manufacturers. I believe that the Undersecretary rolled out these measures in order to control tobacco and protect people's health. I hope that you will be more understanding, and please don't say that anyone who questions your measures are in support of the tobacco manufacturers. As I mentioned in my opening remarks, as we are discussing the policy matters of the bill, I allow members to speak extensively on the topic, but please observe the time limit. Ms. Doreen Kong. Thank you. Secretary said just now that if we don't make any progress, we will lag behind in terms of our efforts to control tobacco. The number of smokers in Hong Kong has been decreasing over the years. So we're still definitely making progress. I'd like to cover some broader issues first. Now, speaking of tobacco control, having referred to the PowerPoint presentation and our previous data, it seems that we are not just controlling tobacco, we are trying to ban it. And there will be people's interests being harmed. because of the measures. I do understand the harmful effect of secondhand smoke. When we try to lower the number of smokers substantially and in order to transition to a smoke-free city, it may undermine people's freedom. Many research papers say that smoking is harmful to people's health, but if we are to ban anything that is harmful to people's health, then we should prohibit people from smoking, from sitting all day long. If we look at this from the perspective of public health costs or economic loss resulting from tobacco-induced health problems, the cost is to keep our city free. That's why we have to shoulder the public health cost. Are we going too far? We have some long-term measures with no timetable of implementation. I think that we're going too far with these tobacco measures. I think that we should perhaps also ban consumption of candies, alcohols, and all sorts of products that are harmful to people's health. In 2007, Hong Kong U and the Queensland University conducted a research looking into the cost of smoking on the loss of productivity or direct health costs. Altogether, in 2007, it was about $5.3 billion rather. The government said that in 2004 or 2024, the cost is $8.2 billion. In 2021, we have 580,000 smokers, and that's a drop from 670,000 from 2005. How come the cost of smoking or the economic loss resulting from smoking has gone up from $5.3 billion to $8.2 billion? Now the government is trying to ban all e-cigarettes flavored smoking products and all sorts of smoking products. The same ban only appear in, say, South Africa. I wonder what other kinds of advanced economies actually implement the same types of ban. Undersecretary, now speaking of freedom and rights, there has to be a free will and people have to be able to make an informed decision. After you have become addicted to smoking products, you no longer have a free will to choose because you have no way to, say, quit smoking when you're addicted. On the question about public cost, Dr. Feng Ying will supplement later on. We implement these tobacco control measures not just to lower the public cost of tobacco-induced health problems. Because of our aging population and medical cost inflation, the economic loss resulting from these problems has been rising over the years. Regarding the $8.2 billion study, I will ask Mr. Feng Ying to further elaborate. Thank you. The University of Hong Kong updated the figure based on the latest medical cost. Although the number of smokers increased, the tobacco-induced health problems such as lung, heart diseases, and cancer require specialist treatment. As there is a medical cost inflation, That's why the economic loss and the medical cost resulting from these problems has increased despite the drop in the number of smokers in Hong Kong. Smoking prevalence is highest among people aged between 40 and 49. If they don't quit smoking, they will start having smoking-induced health problems when they reach the age of 65. Next, Mr. Dennis Lang. Thank you, Chairman. I have to declare interest. The union that I work with is in the tobacco business. On medical expenditure, 5% of patients undergoing treatment in hospital account for 60% of the medical costs that we bear. So in order to better utilize our medical resources, we have to implement these control measures. I'd like to talk about control of alternative smoking products. That is under Proposal 3. I don't understand why the government is not banning all types of ASP altogether. A few years ago, we banned the import and sale of ASP substances. However, on the streets, we see many people using ASP devices to smoke. When people are holding traditional cigarette sticks, I would know that they're smoking. But some people actually use ASP devices to smoke in no smoking area. Some of them use these devices to smoke space oil drugs. As a non-smoker, I inhale a lot of second-hand smoke, and I don't know if I have inhaled any space oil drugs. So I think that the government should also ban this type of ASP devices. There is a fixed penalty on the possession of 5 ml of ASP products. How is the government going to take enforcement action? Are you going to prosecute them? And if the case is taken to court, what is the maximum level of penalty? Most people in Hong Kong don't smoke. I think that you have to inform them about your measures and the level of penalty before they can show you support. Thank you. Regarding whether we can advance the implementation of the ban on ASPs, we have actually consulted many different stakeholders. The date that we decided is one that is supported by most stakeholders. Regarding the penalty on the possession of ASP substances, I will ask the Deputy Secretary to elaborate. Please refer to the table in my PowerPoint presentation. I can give you more details. On possession of ASPs, possession of small quantity, there is a fixed penalty of $3,000. Possession of more than that, there is a fine of $50,000. Mr. Stephen Ho. I have to declare interest. I don't smoke. Many people are of the view that the government efforts in controlling tobacco has been very heavy. I don't think that any LegCo members is against any tobacco control measures. When the government banned e-cigarettes and the sale of ASPs, they said that no economic loss would be resulted. However, after that, they came back to reinstate the allowance for the sale of some types of products. The economic loss resulting from tobacco-induced health problems was about $8.2 billion. We increased the duty of cigarettes by 74%. The economic loss resulting from such health problems used to be $3.8 billion, or 7-point-something billion dollars. However, the number of smokers actually reduced by, say, some 9.1%. So where has the $1 billion to $2 billion gone? I think that you have to show us more data on the economic loss resulting from tobacco-induced health problems. This undersecretary said that there is economic loss resulting from people smoking. However, some people rely on smoking-related industries, say the catering and retail trades. Their livelihood may be affected by the tobacco control measures. The government often say that over 90% of people support your measures. Of course, because only less than 10% of people in Hong Kong smokes. So I think that we have to be fair. Second, it's not enough for us to just control tobacco in Hong Kong. Many people don't know that we have banned e-cigarette cartridges, and they bring them into Hong Kong. In order for us to become a leader in tobacco control, we must step up publicity and promotion. We have to make people aware of the harmful effects and hazards of smoking. Hong Kong, Macau, and the Greater Bay Area should work together to control tobacco and align all of our tobacco-related legislation. If our tobacco control measures is too strict, then these 9.1% of people may try to smoke in other places, and we may have to compete with other cities because some people may be driven to other places because of our ban. So my questions is about the overall roadmap of government's efforts in tobacco control measures. I'm fine with 8 of the measures on, say, the plain packaging requirements, the duty paid, duty stamp systems, the no smoking areas. Thank you.
Economic impacts and your interactions with GBA cities. Undersecretary, I thank Mr. Stephen Ho for the comments. We understand that sectors concerning tobacco traders, they have different concerns. That's why we had a rather long public consultation period. Some members asked why we did not roll out some of the measures earlier. Well, these measures are the result of our discussion with the members of the public as well as LegCo members. That's why we're not imposing stringent measures all in one go. We understand the industry's concerns. We also understand that there is difference between us and the neighboring cities. Indeed, the mainland authorities from Beijing, from time to time, they visit Hong Kong and they share with us their thoughts. The mainland has also joined some of the UN conventions which entail tobacco control strategies. We often say how we can learn from the mainland to control the use of tobacco. In Shanghai, in this March, they have banned tobacco products completely indoor, and outdoor they do not allow tourists to smoke. In some photo-taking spots, they do not allow people to smoke either. So we might be walking or moving at a different pace compared to the mainland, but we are heading to the right directions. How can we launch a better publicity campaign to allow people from the neighboring places to know about our policy, what we would think about this? How about the point about economic impacts? I don't want that Hong Kong suffers from great economic losses after the bill is passed. Last time, the ordinance had to be amended again because of economic loss. Undersecretary, I understand Mr. Ho's point. Neighboring cities like Singapore, they impose stringent measures too. And this is not in conflict with their economic development. Back in 2007, we had just banned indoor smoking. Many people back then were worried that this would pose a huge impact on the businesses. But we looked at the statistics. After 2007, after the ban, we saw an increase in businesses in restaurants. So tobacco control strategies, do they impose economic impacts? Well, statistics show that we don't have to be so pessimistic and expecting an economic loss. Mr. Tang Fei, I declare that I am a member of the Council on Smoking and Health. I think the duty stamp regime as well as the packaging requirements are great. I collect many packages with duty stamp, but it's hard for you to enforce the law. People can order cigarettes online. They can order packages with duty stamp affixed on them. So how can you enforce the law? Now about the 3-meter area without smoking. No, the intention is great, but the 3-meter distance is not a huge distance. I'm worried if there might be disputes. Some smokers may argue that they do not know that it is a school or a care home. There are schools in housing estates managed by Link REIT. And people may not notice that it's a school. Smokers may argue that why don't erect signage showing that it is a 3-meter no smoking area. So there might be civil litigations or disputes arising from this. So my question is, for care homes and schools, will they be made responsible to erect signage showing that it is within the 3-meter no smoking area? Also, I'm looking at some statistics here. In February this year, primary 4 to primary 6 students who consume ASPs or e-cigarettes, we are seeing a rise in the number. For primary and secondary school students in Hong Kong, they're not like those in the past where people thought smoking is a cool act. How come primary students are smoking e-cigarettes? How did they obtain e-cigarettes? Either from family members or from other means. Well, I don't have the statistics at hand. But anti-narcotics policy show that young people smoke drugs because their family members do. From this, we can deduce that primary students, they obtain e-cigarettes from their family members. Also, at the community level, how come there are people selling e-cigarettes to primary school students? So this is not just a problem about education, it's also about law enforcement. How come there are people who can sell cigarettes or e-cigarettes to primary school students? Undersecretary, I'll first invite Dr. Feng Ying to address the question about ASPs and the 3-meter area. Afterwards, I'll invite the CNED to supplement. Dr. Feng Ying. Within 3 meters of the doorway or entrances of certain premises, it will be designated as no smoking area, and we will launch an extensive publicity campaign about that. Within 3-meter distance, we should be at least able to see the gate and the doorway. There is a statutory defense for smokers in the future. For smokers, if they do not notice any gates or doors there, it could be a statutory defense, and this is set out in the bill. There are different NSAs in Hong Kong, both indoor and outdoor. We haven't encountered many problems in terms of law enforcement. After years of publicity and promotion, it's not hard for people to notice what an NSA looks like. So we haven't encountered many disputes when we issue tickets during law enforcement. We don't anticipate many problems either after the passage of the bill. On the point about e-cigarettes, every 2 years we conduct a school survey. We see that over the past 2 surveys, the usage rate in terms of tobacco products is rather low. Of course, we're still seeing some primary and secondary school students who consume tobacco products. Illegal sale channels have now shifted online. There are very few physical shops now. Since 2023, we have removed over 3,000 online sale points that sell products or promote tobacco products. We will also launch publicity campaign at schools together with the council. We have been launching the campaign. Oftentimes, we see people getting cigarettes from their friends, peers, or family members. So again, we will step up our publicity efforts. CNED. We want people to be able to distinguish paid duty cigarettes and non-duty paid cigarettes. There are 3 major crimes under the bill. In future, all cigarettes should have a duty stamp. Secondly, with the permission of the Commissioner of Customs Excise, people may be able to sell cigarettes, but all cigarettes have to have the duty stamp on the packages. Also, false duty stamp or making use of false stamps, it will be a crime. Ms. Carmen Khan. Thank you, Chairman. I have the following observations. According to the Health Bureau, in June 2024, the government already announced a series of tobacco control strategies. Back then, there were 10 strategies, but there was a lack of concrete timetable. It is the 13th of May this year, 2025. It's been a year or over a year since the government launched its public consultation. The government has talked about different tobacco products such as base oil drugs as well as capsules and how people can make use of ASP products to consume space oil drugs. I'm shocked that the young generation can make use of ASP products to take drugs. I am very concerned about this. So the measures proposed by the government are formulated after they have listened to members' views. I don't think the government should get all the supporting views from members to launch these measures. 9.1% of our population are smokers. I don't expect that you get all the supports before you implement the measures because you should have the determination to do so. But at the same time, you should take into consideration the impacts on the economy. Understand your dilemma and struggles. Now, according to your PowerPoint presentation, I see that in the short run, 8 out of the 10 strategies involve legislation. There are also medium and long-term measures proposed. Medium measures cover banning smoking while walking. Well, some say that you should prohibit smoking while walking now instead of just banning smoking while queuing. But law enforcement is tough, so you put it at the medium-term measures. In the long-term measures, you are prohibiting the sale of conventional smoking products to persons born after a certain date. You're also planning to extend certain no-smoking areas. Now you're proposing a 3-meter distance instead of a 10-meter distance as no-smoking areas. I think you are adopting a reasonable and pragmatic approach. The measures that you are proposing now under the bill, you're confident that you'll be able to implement them. I have the following questions and comments. I may speak for the second round if I don't have enough time this round. For the duty stamp system, I think this is one of the most urgent measures. It is only with this duty stamp system that you can make the other measures effective. That includes prohibiting cheap whites, and that includes proving that they are cheap whites or duty-paid cigarettes. That includes also ensuring that there is a duty stamp on the cigarettes brought by tourists to Hong Kong. You will invite local manufacturers to join the pilot scheme. It will span 3 quarters from Q4 2026. If time permits, I'd like to learn from you how you will make use of the computing system and so on. You expect that by Q2 2027, you'll be able to launch the scheme. I want to know how you're actually going to implement the duty stamp system.
My second question on the position of ASP starting from the 30th of April 2026, anyone smoking ASP will be considered as having ASP. By then, the ban on possession of ASP substances would have been implemented for 4 years. The government said that they want to allow time for smokers to handle the remaining stocks. That's why the ban on ASP possession is proposed to take effect on the 30th of April 2026. Thank you. You can press for the second round. Under Secretary. Thank you. I believe that the second point is a comment. We believe that we have to step up enforcement. We agree with that. For the first question, I will ask the Deputy Commissioner of Customs and Excise to elaborate. Thank you. In the third quarter this year, we're going to roll out a pilot scheme. We will invite tobacco manufacturers to join it. Hopefully, through the pilot scheme, we'll be able to look into the technical issues, the design of the system, and how we should, say, print or distribute the duty stamps. In the fourth quarter of 2026, we will roll out the transitional phase of the duty stamp system. As mentioned, there are still duty not paid cigarettes on the market. We want to allow time for transitioning. That's why the scheme will not be implemented until the Q2 of 2027. By then, all cigarettes should be affixed with duty stamps. Thank you. So you are not going to take enforcement action during this transitional phase, am I right? Yes. What about the point about primary school students possessing ASPs? Thank you. We will definitely take enforcement action. If we see videos of such, we will ask the schools to follow up. The police and the health department will also take action. In the future, no one will be allowed to sell ASPs to any persons aged below 18. Neither can they sell conventional smoking products to them. There are still many ASP substances on the market. That's because we have not plugged the loophole of, say, private possession of ASPs. People who smoke ASP on the streets may claim that they are just clearing the remaining stock. There is still demand for ASPs because people think that they wouldn't be charged or prosecuted by claiming that they are just clearing their remaining stock. If we ban the smoking of ASP, then we believe that the demand will drop. So that will also combat primary school students smoking. Yes. Next, Ms. Lillian Kwok. Thank you, Chairman. We've been talking about the problem of youth smoking. I'm disappointed. The 10th measure is strengthening smoking cessation services as well as publicity and education. I think that should be our first short-term measures, and that's the most important measure. No matter how hard we try to ban tobacco products, people may travel overseas to smoke. If we can do our publicity and education well, then our young people would not be lured to pick up smoking. The same goes for taking drugs. It's a pity that you treat smoking cessation services, publicity, and education as the least important measure. Is our efforts in this area enough? Seems that is not as effective. According to NGO studies, there are people who start smoking since the age of 7. Smokers are getting younger and younger. I understand that the administration will roll out the 8 measures first, but the government should step up still publicity and education. I believe that people in my age group will remember that in our health classes, we will see 2 lung models, and we'll see how the lungs become darker and darker when the person smokes. I think that we should show students visually the hazards of smoking. All the students see these days are pictures and images. I think that different government departments should work together on this. Second, we have counselors in other countries who help with smoking cessation services. In Canada, they have counselors and district health centers who conduct smoking cessation services. We do have chronic illness screening services, but not many people are of the view that they have such diseases. Many people have no ways to quit smoking, and sometimes they stop for a while and pick it up again. I think that we should include this type of cessation services in the district health centers. By this, we can lower the number of smokers at source. Third, enforcement. Frontline officers in the CNSD and the TACO told me that it's difficult for them to take enforcement action at boundary control points, especially with fixed penalty notices issuing. When people are taken to court, the fine that they get is sometimes even lower than the fixed penalty. So how do you strike a balance? I'd also like to hear from the CNED on how they can solve the problem of enforcement at their boundary control points. Undersecretary, I will ask the Deputy Commissioner to talk about enforcement at boundary control points. On the point about publicity and education, the reason why it's the 10th measure is because it's not included in the bill. We all along have attached a great importance to publicity and education. As to whether we can invite counselors to provide smoking cessation services, we may consider it. Deputy Commissioner, please. Thank you. As mentioned, we now substitute prosecution with fixed penalty. When visitors enter Hong Kong, if they possess more than 19 cigarette sticks with no duty paid, then we may issue a fixed penalty notice. Second, we may take them to court. As mentioned, the fine handed down by the court is usually lower. So how do we tackle this problem? Now, in the court documents, we will state how high the penalty we're going to give to the visitor, which is usually about $5,000. We set that out in the court document so that the judge would know how much the visitor is fined if they're caught at the boundary control point. Next, Ms. Chan Hao-yan. Thank you, Chairman. I was in another meeting, so my questions may duplicate with that of other members. Can I go back to the PowerPoint presentation? I'd like to ask about the no smoking areas near schools. We are going to extend the NSAs. 3 meters from the doorways of schools will be assigned as NSAs. The government said that contraveners may raise a defense if they don't know the existence of a doorway or gateway. But smokes actually can go everywhere. We legislate in order to protect the young and the frail and people in the hospital. But the 3-meter area is too small. As long as you are just slightly outside the 3-meter area, you can start smoking. But the secondhand smoke may also still be inhaled by the protected grips. It is also said that the Secretary for Health will be empowered to designate NSAs. We already have NSAs now in the existing legislation. So I don't really understand the new measure. Why do you state specifically that you're going to empower the Secretary for Health to designate NSAs? I'm concerned about our next generation. In the future, in 2026, you're going to ban the provision of ASPs to persons aged below 18. Young people will not be able to purchase cigarettes at convenience store. How come the ban of sale of ASPs to underage people will only take effect in June next year? Or rather, the 1st of January 2026. I think that you should start the ban now. Thank you.
Many members have raised questions about no smoking areas. Perhaps Deputy Secretary can supplement. Thank you, Chair. On the 3-meter area, we have tried to strike a balance. We have looked at the practices in different places. Some adopt a 5-meter distance, others adopt a 10-meter distance. We are striking a balance here based on the circumstances in Hong Kong, given that there are many narrow streets and roads in Hong Kong. Like Dr. Feng Ying said, it's easier for people to tell whether it is an NSA if it is a 3-meter area. So if you're close to the doorway or gateway of a designated premises, you will not smoke. We try to build a healthier smoke-free culture in Hong Kong. With these rules in place, I believe smokers will cooperate. They may not stop smoking just within a 3-meter distance, but also within a 4 or 5-meter distance. Now, on extending the non-smoking areas, our bill focuses on certain premises now, like cinemas or indoor premises. We want to allow certain level of flexibility. We may not apply a broad brush approach in the future if we want to extend NSAs. For larger areas, we might actually designate a small zone that could be exempted. In Singapore, there's a CBD that is smoke-free. We want to learn from it. So we want to have the flexibility to allow us to extend no smoking areas in the future. How about the point about not offering cigarettes to those below 18? Even upon the passage of the bill, we will launch education and publicity campaigns, and afterwards we will have that rule take into effect. If members of the view that we should advance the implementation of that rule, we will look into that, but we want to have the bill passed first. Mr. Paul Chase speaking for the first round. Thank you, Chairman. The Undersecretary said the strategies are like a boat sailing against current. I personally think that Hong Kong is doing quite well compared to other places around the world. Tobacco traders are defeated every time there are stringent measures imposed. You set a very high threshold and standard for tobacco traders. We have had many discussions over the past decade or two on this topic. There haven't been any new ideas. For the first round, I want to not focus on the policy, but rather on the theory. Some members talked about freedom and free will. Well, we should look at it from the mental and physical perspectives. For drugs, it could have to do with your mental health. For cigarettes, it may have to do with your physical health. It's hard for you to ban all kinds of bad practices like gambling. To give you an analogy, 145% of tariff is like banning trade. So we're not far from banning cigarettes or smoking. The government is proposing all these tobacco control strategies. If you don't look at the slide, can you memorize or cite all the strategies and rules? It's quite challenging. You are the expert on this, but you may not be able to cite all the rules without looking at them. How will you expect members of the public to remember all these rules and level of penalties? How are you going to test if members of the public can remember all these rules? Some members said to make these strategies effective, we have to do this with the Greater Bay Area. We often follow the national policy. For example, we ban sashimi from Japan. Well, this is not the main point. I just want to let this out. Dr. Feng Ying just now said that there will be statutory defenses for smokers. But there won't be many cases, of course, because those who do not know how to fight a case, they do not dare go to the court. And for those who know how to do so, they may not have enough money. I don't see many new ideas here, but according to Dr. Feng, smokers mostly concentrate on the age group of 40 to 59, and they're mostly male. Cars, buildings, and windows, we only inspect them when they get old and dilapidated. Why don't you impose a mandatory requirement for those aged between 40 to 59 to have health checks, and if they get any chronic illnesses or health problems, you can ban them from smoking. This is what I call a new idea. You can try this out. This can ensure free will and freedom. We might be able to achieve victory through this. Undersecretary, this is a very creative idea. I want to respond to one point. We've had discussions about this for years. Back when I was not a doctor, I had already heard this discussion. For the younger generation, they haven't heard about this yet. We want the younger generation, the young people to learn about this too. So this is a form of education and publicity as well. For those who can recite all the 8 strategies, I believe Deputy Secretary will be the one. However, I understand that other people may not be able to do so. That's why we keep repeating these strategies. from time to time. On the creative idea about imposing a mandatory requirement for those to receive health checks, well, I think this deserves our discussion. Yes, you only allow people to buy cigarettes after they're receiving health checks. Mr. Michael Teen. As you all know, I was once a smoker. But one day my daughter told me that I smelled. So I was determined to quit smoking. When I was smoking, I didn't find a huge problem with secondhand smoke. It is only after I had quit smoking that I found second smoke intolerable. I support building Hong Kong into a smoke-free city, but I have the following 2 suggestions. On banning flavored cigarettes, I object that you adopt a phased approach to ban menthol cigarettes and flavored cigarettes. You should ban 2 types of cigarettes in one go. Your goal is to bring the smoking rate down from 9.1% in 2023 to 7.8%. According to my understanding, nearly 40% of smokers in Hong Kong, they smoke flavored cigarettes. They're mostly women. This is because menthol cigarettes are easier. Tobacco traders know this. That's why they manage to attract non-smokers through these types of tobacco products. You are first going to ban flavored cigarettes, and you don't have a timetable yet for banning menthol cigarettes. I don't understand the logic. For tobacco products that are less popular, you are banning them first, but for the more popular ones, you are not banning them now. Tobacco traders will have time to roll out new products, and in the end, you may have a higher smoking prevalence. You may have a smoking rate of 10% or higher, as there may be more people consuming menthol cigarettes. So I don't know what you're trying to achieve here. You're not banning menthol cigarettes now, and you haven't even achieved your targeted smoking rate, which may go up one day. To be frank, I really don't understand the logic here. So I'm against this. You're heading to the right direction, but you're not placing the right effort here. So please share with us what kind of challenges you're encountering here. For outdoor licensed restaurants, they still allow people to smoke. I went to a Sai Kung seafood restaurant with my family. It was a very crowded restaurant. We were sitting outside the restaurant in the outdoor area. When the dishes came, when I was about to taste the food, some customers sat down and started smoking, and the smoke traveled to my direction. Should I cancel the order and leave the restaurant? The restaurant owner didn't do anything because smoking is not banned outdoor. So I have this thought. I think it is important to ban smoking in eatery premises. For licensed restaurants, would you consider banning smoking in the outdoor area? 2 questions on the Secretary. Thank you, Chairman. On flavored cigarettes, we're adopting a phased approach. The goal is to ban all the flavored cigarettes, but we got different views during the public consultation. Indeed, we will need time to enforce the measures. For example, we will have to implement a certification regime. For flavored cigarettes that come to Hong Kong, we need a certificate proving that they are not flavored cigarettes before allowing the import. We'll need time to work on the regime. Secondly, for young people, they mostly consume fruit-flavored cigarettes. Their second option is menthol cigarettes. If we are to implement the first phase, we should ban the fruit-flavored cigarettes first. Subject to the success rate, we will ban menthol cigarettes in the future. Ideally, we want to ban all these flavored cigarettes in one go.
咁你需要時
I don't really understand that timetable. The problem is that you're only banning non-methanol cigarettes, but not menthol cigarettes. So I don't really understand your reasoning. Second, you said that people who smoke for the first time usually choose fruit-flavored cigarettes. How did you collect the data? Because for the friends I know, they pick up menthol cigarettes when they first smoked. Undersecretary. Thank you. We have to issue certificates to importers of flavored conventional smoking products. In order to test the system, we want to start with a smaller batch of cigarettes, that is fruit-flavored cigarettes. When the system is implemented very smoothly, we will ban menthol cigarettes as well. We conducted some study. It's a small-scale one. We found that most first-time smokers choose fruit-flavored cigarettes over menthol cigarettes. By banning fruit-flavored cigarettes, we want to reduce the incentives of young people becoming smokers. On outdoor areas of restaurants, we have not banned it. We have not included this prohibition under the bill, but hopefully in the future we will also restrict smoking in such area. We accord priority to the old and the frail. If we are banning restaurants, what is the difference between indoor and outdoor area? Deputy Secretary, for restaurants, no one can smoke in the indoor areas. For outdoor, we stipulate the definition of outdoor areas of restaurants in the laws, and people are allowed to smoke. But smokes travel. How come you didn't ban secondhand smoke in outdoor areas with restaurants when you first enacted the law? But there's time limit. You pressed for a second round already. For smoking area and non-smoking area, it's easy for us to distinguish them. One is in the indoor area, one is outdoor. There are still many members waiting to speak. You can press for the second round. Mr. Edward Learn for the first round. Thank you. Regarding the issue of space oil drugs, we are very much concerned about it. Parents of students told us that they are very worried because there's no measures of the government to ban it. We try to ban e-cigarettes because we don't want space oil drugs being mixed in e-cigarettes. However, I discovered that there is no technology for us to test whether someone have taken space oil drugs. Currently, we do have a piece of paper to distinguish whether e-cigarettes contain nicotine or space oil drugs, but there is no way for us to test whether someone has taken space oil drugs by testing their hair or skin, for example. Second, on the voluntary drug testing regime at schools, it covers weed and hardcore narcotics, but no space oil drugs is not included. So I hope that the government will work with narcotics-related departments to see how we can see if students have taken space oil drug. Because even with the Healthy School program with a drug testing component, there's no way for us to tell whether someone has taken space oil drugs at school. While we are combating e-cigarettes, we must take a step further to also ban space oil drugs. Thank you. Under Secretary. Many members are concerned about space oil drugs today. Thank you. Space oil drugs is positioned as a drug. We will work with the relevant parties and departments to see how we can do things better. Thank you. Some housekeeping. There are 8 members who have pressed the button for the second round. Our meeting was supposed to end at 10:30 p.m. After Mr. Stephen Ho and Mr. Xiu have spoken, I will end the meeting. Okay, Mr. Kwok has pressed the button for the first round. Mr. Kwok, please. Thank you. Chairman, good morning. I've been talking to the administration about the measures. They have carried out extensive consultation with the trade and stakeholders. I have 2 questions. First, we have been trying to increase duty in order to encourage people to quit smoking. These measures have been put in place for a long time. For those who have yet to quit smoking, are they actually eventually going to do it? What we are more concerned is how we can prevent young people from becoming smokers. We've covered the control over flavored cigarettes, e-cigarettes. It seems that our goal is very clear. We don't want any young people becoming smokers. So why don't we just prohibit the sale of CSPs, conventional smoking products, to persons born after a certain date, just like Australia? People born after a certain day will not be able to purchase smoking products. I think that we should do it as soon as possible. Second, we're banning smoking while queuing. I support it on a pilot basis. Previously, we designated NSAs as smoking in certain areas. In order for us to ban smoking while walking, we have to designate a larger NSAs in order to achieve the same effect. We are proposing to prohibit also smoking while queuing. Is the legal framework of it different from prohibiting smoking while walking? Undersecretary, you have already answered this question. Please be brief. Thank you. On whether we should prohibit the sale of smoking products to persons born after a certain date, that's a long-term measure of ours. We will look into whether we can advance the implementation date. We also have to look at the community's views and response of it. We empower the Secretary for Health to designate a large NSAs with a time limit. If the NSAs is very large, then no one can smoke in it, and as a result, no one can smoke while walk in the same area. Mr. Stephen Ho, thank you. May I stress once again that I support tobacco control. I just think that the examples of the government is not appropriate. I don't think that the government's assessment is reasonable. They should not have quoted the example of banning smoking in restaurants. I think that you should go back and think about how we can deal with the problems of heated cigarettes. I think that we should say advance the implementation of some medium-term or long-term measures to protect our next generation. And we should reflect the gravity of the hazards of smoking in the penalty. For provision of CSPs to young people, there's a fine of $5,000. Provision of ASPs to young people, $50,000. Why is the level of penalty so much different? I think that smoking harms people for their lives. So it's reasonable for you to fine the provision of ASPs or cigarettes of, say, $30 billion. For people who bring more than 19 sticks of cigarettes, they will be fined $5,000. I don't think that anyone would intentionally bring more than 19 sticks of cigarettes on purpose, because otherwise they wouldn't be using the boundary control points. I think that you have to distinguish between people who contravene the law intentionally and unintentionally. And you should increase penalty for offenses that may harm people for life. On the designation of NSAs and prohibiting people smoking while queuing is very difficult to enforce. I think you should just designate the boarding location of bus as no smoking area. Because it's very difficult for us to, say, define a queue. What if there is only a single person at the bus stop? Why don't you just designate the bus stop as a no smoking area? That's easier for you to enforce the law, and that will not pose any confusion. You can also empower the Secretary for Health to designate the outdoor area of hospital as no smoking area to make things more easy and convenient for the people. I supported your efforts in banning smoking in restaurants. I will extend the meeting until Mr. Xiu Kafai is spoken and the reply to his questions has been given. Deputy Secretary, thank you. Let me talk about the issue with no smoking area. We have considered your suggestion. We also want to make the law more easy to enforce. But if we designate the boarding location of bus and minibus as non-smoking area, then in a single street in our city, there may be no smoking areas of different sizes. It's more difficult for people to comply. There are many different ways for us to achieve the same result, but we want the laws to be easily operable and make it easier for people to comply. As I said, I don't want to see no smoking areas of different size in the same street. Perhaps you should talk to some chamber of commerce or unions. You can draw a smaller no smoking area. The area could be, say, 0.5 meters. As long as it's clear, then people won't have any problem to comply. It's easier for them to tell whether there is a line formed at a boarding location. Are two people queuing considered a line? It's difficult to tell. Mr. Xiu Kafai, thank you. Many people are concerned about the impact of the measures on tourists. Secretary for Health, Professor Low, said that visitors don't come to Hong Kong for the purpose of smoking. Tourists come to Hong Kong for 3 days, not for sleeping either, but they have to do so. With our measures, we are essentially banning smoking. Visitors who are smokers may be affected by our measures when they come. Undersecretary said that we have to step up our efforts by increasing the duty of some 70%. The revenue generated from a duty of cigarettes have decreased. We have a 9.1% smoking prevalence. Is that an increase or decrease? We have no way to tell. It seems that more and more conventional cigarette smokers are purchasing illicit cigarettes because of the high duty. I support all the measures because by this, less people will smoke. But for some of the measures, say the duty stamp system, it will help us combat illicit cigarettes and cheap whites. The Undersecretary said that with the duty stamp systems and the ban on flavored cigarettes, we can ban cheap whites and combat them. There are different retailers selling cheap whites, and some of them are being sold at a price lower than tobacco duty. We are suspicious that these tobacco products are not duty paid, and now the administration is putting in place the duty stamp system so that duty stamp have to be affixed on the duty paid cigarettes so that people can tell if the tobacco products sold at some retailers are duty paid. However, sellers of illicit cigarettes would not be paying duty, and they will continue to circulate on the market. And what does it have to do with flavored cigarettes?
About duty stamp and enforcement. Deputy Secretary. The simple answer to the members' questions is that if we ban flavored cigarettes, there might be illicit cigarettes. Illicit cigarettes are normally sold in illegal channels which are not duty paid and without duty stamps. So what we have to do is to implement the duty system regime. For those sold in the market and for those who are going to be imported to Hong Kong, they will all be affixed with the duty stamps. With this regime in place in the future, it will facilitate our law enforcement actions. It's as simple as that. I just want to add one point. The government is to ban flavored cigarettes and menthol cigarettes. Without banning tourists to consume these tobacco products, it is because the government want to make this reasonable. But for those who bring more than 19 sticks of flavored cigarettes to Hong Kong, the CNED or the police will not be able to enforce the law. For those in Hong Kong who want to have flavored cigarettes but cannot buy them through legal means, they may be forced to purchase illicit cigarettes. This is my preliminary judgment. Well, we have time to have further discussions. Perhaps we can discuss the pros and cons further about the policies in the next meeting. We are coming to a close to our discussion today. There being no further business, I will notify members of the date of the next meeting. Today's meeting is adjourned. Thank you, government representatives, as well as fellow members, for attending. Thank you.